कोण आहे तिथे? कोण आहे तिथे?
अरे एरर येतोय फेसबुकचा एरर येतोय. थांब, मला निखिल करवंदाला फोन करू. हॅलो. चला स्टार्ट.
Good afternoon. I am Dr. Komal Vivek Raul. I am the Deputy Superintendent Vet, and I, first of all, would like to send the wishes for a happy World Environment Day, 5th June, which is celebrated as the World Environment Day. And this day, today, we started with a very nice activity. We started it with a tree plantation, and I proudly say that in BJB Udyan and Zoo, we have planted 3 rare varieties of trees. One is the Rudraksha tree, one is the white apple, and one is the Krishnavad. And we also launched the virtual tour of the Mumbai Zoo. Because of lockdown, people cannot come to the zoo, and we are aware that you all are impatiently waiting to come and see the animals. But this is not possible. So we are going to come to your houses and show you all our animals. All you have to do is just log in to the Mumbai Zoo social media sites. Today, one more thing that we are going to do is we are going to tell you about the relationship between the environment and the public health, especially due to this in this COVID era. And for that, we have an expert which we have invited. Her name is Dr. Sunali Khanna. I would first like to welcome her.
Thank you,
Hello,
Komal.
ma'am. How are you?
Thank you, Komal.
I'm so sorry. There was quite a bit of delay. We were supposed to get you live in the morning, but because of the tree plantation drive, it got delayed. No problem. But nice seeing you, and we would really like to, hear your talk on this topic. Before we start the topic, I would like to introduce Sonali, ma'am. So, Dr. Sunali Khanna, she is a reputed scholar and she is currently working at the Nair Hospital Dental College. She is the associate professor there. She has authored 65 papers in different international and national journals. She's attended 45 international conferences. The most important thing I think is she's the first and the only candidate to qualify the DNB. So DNB is a diplomat of National Board Examination in Oral Medicine and Radiology till now. She has worked extensively towards the healthcare of elderly and marginalized sections of the society. She has been awarded the membership of the National Academy of Medical Sciences, New Delhi. She is also the recipient of the Maharashtra University of Health Sciences Teachers Research Award 2014. She was awarded the PhD by Maharashtra University of Health Sciences in 2018. She was conferred the Visionary Leadership Award by the Jackson State University, USA in 2019. Uh, she has contributed towards the development of curriculum for UG and PG dental courses, especially the surgery courses, and she has been instrumental in designing training modules and suggesting reforms in higher education. She is an expert on the panel of University Grants Commission as Inspector of Centers for Potential of Excellence in the National Board of Examination, New Delhi, for various academic activities. She has conducted surveys on tobacco related diseases and the cessation practices. She has co authored HIV or the AIDS manual for the health professionals in association with the Mumbai District AIDS Control Society, which is actually a big step towards developing community awareness, particularly among the doctors in interior and remote areas. She has participated as a research person in health awareness programs on national television also. Her biography features in Who's Who in the World, which is a medicine and healthcare magazine, in the Silver Jubilee edition 2009. And in the coming next years, also she was featured in that. She is the immediate past president of the Asian Academy of Oral and Facial Radiology, and she is the third time vice president of the Indian Academy of Oral Medicine and Radiology. She is a keen environmental lover and an activist, and her research highlights importance of environmental health issues in the public sphere, which focuses on the development of approaches to integrating public concerns and precautionary principles into public policy on health. Ma'am, there's so much you've done in such a little time. That's amazing. So,
Thank you, Komal. You've spoken a lot.
so let's start with your presentation. Do you want to say something before we start the presentation?
Just a minute, yes, to felicitate you all. Yes.
Oh, thank you.
A very good afternoon to all the listeners. And I'm indeed grateful to the Mumbai Zoo Authority, especially the director, for organizing this event on the occasion of World Environment Day. I extend my warm greetings to all of you. This is of utmost relevance as it marks the beginning of the United Nations decade for ecosystem restoration. And we are lucky that Mayor Madam is here with us today, and her work is enlightening to us. It's also heartening to note that people's interest in forest and wildlife restoration and regeneration has grown manifold in the recent decades. Now, it's time to rediscover our relationship with nature. And environmental degradation will ultimately affect agriculture and public health. which are the mainstay of our economic growth. So I call upon community leaders and voluntary organization workers to assist public health professionals in creating awareness about biodiversity conservation and its influence on human health. It's important for school and college students to usefully spend their time in digital awareness generation about the need to conserve nature. And I think this is to pass down the generation. It's also about transgenerational equity. I applaud the selfless service being rendered by the Mumbai Zoo authorities and animal keepers to protect their wards in difficult times. I congratulate one and all here for their exemplary efforts to manage wild animals and rare birds, especially during this unprecedented pandemic. And I wish you all success in all your endeavors. Thank you.
Thank you so much, ma'am. Thank you so much. Shall I share your presentation?
That'll be nice.
To all the listeners. I'm indeed thankful to the Mumbai Zoo authorities for giving me the opportunity to address this forum on World Environment Day. And I'm going to talk about environment and public health linkages in COVID era. Take a look at these images flashing across the screen. What strikes you? What comes to my mind is India with a cultural diversity, socio-demographic factors, biodiversity, wildlife, natural bounty, landscapes, and of course, all this leading to health disparities. We are also a productive nation. We have a large amount of the youth population. Therefore, preventive health strategies and environmental conservation become our priority, as this population needs to be our asset and not our liability. If you see the areas of Leh Ladakh, Pengong Tso Lake, the rainforest, the tea gardens of Darjeeling, areas in the northeast, there is a wide variety of geographical variation and also climatic conditions vary. From the ravines of Chambal to the marble rocks of Balaghat, deserts, there is a lot of climatic variations which affect the health of the biodiversity and the individuals. Climate induced variabilities like changing precipitation, melting glaciers, rising sea levels, and flooding have impacted not only the economy, flora, and fauna, but also public health. And that is where I'm going to draw your attention today. India is on course to achieving its voluntary goal of reducing emission intensity under the Paris Agreement. Significant elements are introduction of electric cars, smart cities, and generation of 175 gigawatt of renewable energy source as soon as possible. And so we have seen rapid urbanization, industrialization, mechanization in agriculture, deforestation. Of course, now we look at the positives, we talk about compensatory afforestation. And the awareness amongst the public has to be increased towards our delicate relationship with the environment. At such forums, the question most asked to me by the public is our health affected by the environment? And in the context of the current pandemic, which we are seeing after almost 100 years, when it was the Spanish flu, yes, our health is affected by the environment, but to answer this, we need an integrated system that links data from environment, exposure biology, and human health data. So, is it in our genes and are we hardwired? So, we in fact are gene influenced, not gene determined. So, how relevant is our thinking about risk assessment practice to human health? I'm sure we all agree that one size does not fit all. So, how I'm going to outline my presentation is define the environment for you, provide a conceptual framework, discuss the potential for human exposure to environmental hazards, leading in real causes of death, health risk assessment, very important, impact on biodiversity, ecosystem restoration, and last but not the least, discuss gene environment interaction and the importance of this interaction on disease causation. So, if we look at our future, today we talk about climate change, we talk about public health. Above all this comes ecosystem restoration, socioeconomic determinants, and environmental security. And all this is to bridge the health disparities across countries and nations across the globe. As we all would agree that science should be done in context. So, genomics, molecular biology, biochemistry, physiology are what govern health and disease, and all these get integrated as envirome interactions. So, we do have a climate system, and we know there's atmosphere, precipitation, solar radiation, terrestrial radiation. We have a role to be played by the greenhouse gases, aerosols, the land, ocean, ice sheets, glaciers are all an integral part of the climate system. So, if you look at the entire realm, what is the Earth's ecosystem? Here we have some cosmological and geological processes. Now, all these are induced by human actions. So, there is rapid natural and genetic change that takes place. Let's look at the greenhouse gases. We have surface long wave radiation, we have outgoing long wave radiation, we have absorption of these gases, and ultimately, this greenhouse gas trap leads to global warming. Now, obviously, all this has a biological and social impact. So, we have rising temperatures, precipitation, increase in sea levels. Now, what are the most important impacts? The health impact in terms of the weather related mortality, infectious diseases, which we are seeing today, air quality, respiratory diseases, noise pollution, agricultural implants in terms of the crop yields and the mitigation measures. Forest impacts are so important to our wildlife and biodiversity. So, we also have a geographical range of forests. So, forest health and productivity is our main concern today. Coming to water resources impacts, we have water supply, water quality, and it's also important to see the competition of water. Ultimately, conservation of water becomes a priority. Impacts on coastal areas, very important in today's scenario. Species and natural area restoration. This is an integrated approach which we need to understand, because gone are the times when we can be in our own silos. It's high time that we make sure that we integrate our resources, put our heads together, and come out with strategies of multidisciplinary research and work which really benefits society, and that would be science in context in terms of science for society. Take a look at these land areas that are projected to warm more than the oceans, with the greatest warming at high latitudes. This is, of course, the global picture that I'm giving you. Some areas are projected to become wetter, so others drier, with an overall increase of rainfall. And then we read this all the time nowadays. A newspaper cutting said that the Earth's 2000-year-old climate record revealed. So they have ice aging, and we also have air quality related news Like, there's poison in the air, there's arsenic in the water, there's toxin from e-waste, posh living is polluting homes, it's causing asthma, and a lot of sinusitis in urban population, urban children. Even if we look at pollution in today's context, we are not looking only at water, air, land pollution. We're also looking at environmental carcinogens. We are looking at noise pollution and a lot of other associated factors. This is where we stand today in terms of water land pollution. Though we have campaigns like the plastic ban and we have the Swachh Bharat campaign, and they need to be really applauded. Kumbh, for an example, we have almost 5 crore pilgrims a day. So you can imagine the amount of infrastructure we need to have to prevent the mass pollution and the kind of technology that needs to be applied to ameliorate the situation. Heavy metals in the marine environment are not far away from methyl mercury, selenium, basically, no sector of the ecosystem is not vulnerable now. We really applauded. Kumbh, for an example, we have almost 5 crore pilgrims a day. So you can imagine the amount of infrastructure we need to have to prevent the mass pollution and the kind of technology that needs to be applied to ameliorate the situation. Heavy metals in the marine environment are not far away from methyl mercury, selenium, mercury toxicity. We have it all. So basically, no sector of the ecosystem is not vulnerable now. For an eye opener, what do we see today? We see a lot of landslides, we see flooding, excessive rainfall, overflowing dams, and ultimately inconvenience and disease to the living beings. We have a lot of drying up of water bodies, which affects the biodiversity in forest areas. We have felling of trees, and these are pictures from central India where we had worked on the primitive tribal groups in the Bandhavgarh National Park and around in those areas, and it was a health and environment survey. So, coming back to the environment, what is the natural environment? We have physical, chemical, biological things in our surroundings. Then we have a man made or